Hey everybody, thanks for stopping by. If you're new to my channel, my name is Dan. I am a 41-year-old who is rebuilding his life, and I'm bringing you along on the journey with me as I document everything here on YouTube. And by the way, I'm brand new to YouTube as well, so you also get to see me learn and grow and build a YouTube channel. So if you've seen any of my other videos, you may have heard me talk about nursing school. I was accepted back in fall and I start in May. I'm very excited and I just wanted to give you a short update on where I'm at with that. So yesterday we had our onboarding session and I just want to talk a little bit about what that was like. So what is an onboarding session? So I was a little disappointed. I thought it was going to be more of an orientation where we got to meet our fellow classmates, explore the school, that type of thing. But no, that actually comes later. The onboarding session was more of a last formal meeting to get everybody together and talk about all the things that we need to have set in place before we're actual students and actually start the program. So things like financial aid, background checks, curriculum, health screening, basically making sure that everybody has their ducks in a row and understands what they're getting themselves into. So for financial aid, they went over all the final costs and basically making sure everybody's set up to be able to pay for school. We went over all the clearances that everybody needs to have, which are child abuse clearances, state criminal record check, FBI fingerprinting. And for me, luckily, I already had all of these completed. But basically, you have to pay for a small fee for each of these and actually go physically to a place and get your fingerprints done and then have the results sent to the school. We also have to make an appointment for a health screening. I'm actually going on Monday. So here they just go over and make sure you have all the required immunizations, that you're physically capable of attending school, and they do a drug screening. I did basically the same thing already a couple months ago to start work as a patient care technician in the same hospital system. They talked about our curriculum and how demanding it can be. This is a 16-month accelerated program, so they just want to make sure everybody is aware of the schedule, how it's going to affect your personal life, how many absences you're allowed from class, how many absences you're allowed from clinicals, how many times you're allowed to be late. For us, it's 3, and then on the fourth one, you're out. They talked about the math with an emphasis on pharmacology, drug calculations, and to be aware that that's a big hurdle, it's a failing point. So it was just like a formal last stop meeting to make sure everybody's aware of what they're getting themselves into and that they can have everything taken care of by the time school starts, and to let them know if we have any issues that may come up financially, anything with our criminal history that may come up, if we have a medical marijuana card or anything that may come up on the drug screening, to let them know ahead of time so that these things can either be worked out or just realize that you may not be ready right now and you may have to postpone this for a little bit. I was a little frustrated. I thought this could have been done over Zoom or something like that. I already had most of this stuff done already to begin with. I did get hit with that I have an $1,800 balance that I have to pay by the time school starts. Looks like books are going to be about $1,200, and then a few other small costs like uniforms. Luckily, I already bought shoes, a stethoscope, a few of the other small purchases that we need. So that's where I'm at. I'm excited. I just need to do my health screening, which I'm doing Monday, send in my clearances. I went today and ordered my uniforms. They should be here in 2 to 3 weeks, they said. I did decide to do 2 more prerequisite classes, which I'm doing online right now. I have to have them completed by the time school starts, and that will lighten my course load once I start school. I found out that we have 2 days of class, 2 days of clinicals, and then any supplemental classes are done on Friday. So if you already have them done, you're off on Friday. And that will allow me to work more or study. So that's pretty cool. It's also going to save me a little bit of money. And I have to order my books. I think it's $1,200 if I want the actual physical books, but there's a digital option for about half the cost. I'm undecided right now. I like the idea of having the actual book, but I think I'll be fine doing the digital versions. So that's where I'm at. There's a couple optional meetings coming up before school starts, and then our official orientation. But about 10 more weeks, and I will officially be in nursing school. I hope this answers some questions for anybody that's on a similar path. If this video was of any value to you, please consider liking and subscribing. And thanks for watching. I'll see you in the next one.